Dependency on prescribed drugs simply means that a patient needs them in order to function at relatively normal levels. A patient, for example, that suffers from severe back pain that hinders their ability to carry out their daily work and family activities may require long-term pharmaceutical pain relief to help them accomplish these pursuits. The same is true of people who suffer anxiety disorders. For example, when an emotional disorder includes periods of severe free-floating anxiety and/or panic attacks that do not diminish adequately with the administering of an SSRI antidepressant or other commonly prescribed long-term medications. In cases like these, an as-needed anti-anxiety drug might also be needed. These would include types such as benzodiazepines, which carry the potential for addiction, but that are sometimes the only medications that can adequately control severe periods of chronic anxiety and panic. Some patients are indeed dependent on these types of drugs, but they do not abuse them, and their dependency cannot actually be classified as an addiction. I will add additional clarity to this statement within the next subheading. Obviously, when a patient who is prescribed a medication by their doctors is literally dependent on that drug to feel well or to survive or cope with their medical symptoms, this is a basic description of drug dependency. Some patients, for example, must take hypertensive drugs to control their high blood pressure, and if they were to discontinue them while still suffering from chronic hypertension, the results could be tragic for them, including the possibilities of heart attack, stroke, or even sudden death. This same is true of patients who take medications to control high blood glucose levels, hyperglycemia, that results from diabetic conditions. Should such a patient stop their medications abruptly without medical supervision, they could potentially experience diabetic coma or death. Many other scenarios involving required prescription medications, including those regarding SSRI antidepressants, could be cited, and I think facts regarding dependency are obvious to most laypersons and certainly to medical doctors. The definition becomes more difficult, however, when the scenarios involve medications prescribed for conditions or syndromes involving pain and for those prescribed to treat emotional disorders of anxiety, some of the gray areas. I would remind at the beginning of the information under this heading that we are addressing prescribed drugs rather than illegal drugs. In spite of the fact that drugs can be prescribed by a medical doctor rather than purchased from an illegal drug dealer, addiction to them can still occur potentially. Usually the drugs that are habit-forming and that can eventually lead to the one taking them becoming addicted are those that are prescribed for medical conditions that cause significant pain or those that offer a degree of sedation for those who suffer from chronic stress, anxiety disorders, or types of depression, i.e., bipolar depression with manic episodes, etc. In these cases, patients may begin to seek increasing levels of the pain relief or sedation that these medications provide by taking unauthorized higher doses of them and by taking them more frequently than allowed by their prescriptions. These are signs that addiction to them has begun and that the patient may be facing serious problems if it is not brought under control. The fact is that medications that are prescribed have set dosing instructions and refill allowances, and a patient cannot exceed these if they are attending the care of one medical doctor who is carefully monitoring their medication intake. When a patient runs out of their prescribed drug much sooner than allowed, or when they request frequent dose increases, this should send up a red flag to their doctor. It should also be understood, however, that patients do request dose increases due to a legitimate need for them, and so when this occurs regarding pain relievers or with as-needed anti-anxiety drugs, a judgment call must be made by the treating doctor as to whether this indicates a trend toward addiction or if a patient is in sincere need for an increase in their dose to control medical symptoms. Even when addictive behaviors are suspected by a doctor, they should never abruptly stop a patient's medication, but should begin a structured plan to wean them off of it and to start them on a replacement drug trial that presents less of a danger to them for eventual addiction.